From the Alliance for Camp Health, this is Elevate and Relate. I'm John Hamilton. Every summer, thousands of healthcare professionals head to camps across the country. They're not just treating scraped knees and supporting kids who are missing home, the bumps, the bruises, the things that we're seeing. They're innovating new approaches to camp health, building communities of care, and solving an evolving ecosystem of challenges. Today's show, we're doing something a little bit different. Instead of focusing on one topic that we're going to hone in on, we're actually bringing you two of my most favorite humans and the sharpest minds in the camp health space across the entire industry. And they're here to answer questions for you all as camp health directors, leaders, healthcare providers, behavioral health specialists. And they're here to answer these questions as we head into the summer of 2026. These are the questions that are landing in our inboxes or as we process things with our colleagues, our advisory group, our board members. These are the things that are coming into our info@allianceforcamphealth.org email, and they're getting raised in staff meetings and keeping maybe some of you up at night as you prepare for what is ahead. Vaccine policy, infectious disease trends, tick-borne illnesses, medication management, staffing, documentation. We're tackling them today, one by one. Stay with us. As we head into our time today, I want to first introduce these two amazing human beings. First, Dr. Tracey Gaslin, the CEO of the Alliance for Camp Health, a pediatric nurse practitioner, family nurse practitioner, and researcher whose work spans pediatric development, behavioral health, and service leadership. Oftentimes when I get to stand and share about Tracey, I say that there's probably as many letters next to her name as there are in the alphabet. And that is not representing fully the truth of who she is and what she has to offer. She's the leading voice in the camp health industry in the United States and Canada. Joined alongside her as another incredible human being, and I'm coming to you from her state where it is the way in which life should be. This is Dr. Laura Blaisdell. She's a board certified pediatrician and holds an MD and MPH from the University of Minnesota. She practices at Maine Medical Center and is on faculty at Tufts University School of Medicine. She is a nationally recognized expert in vaccine communication, vaccine hesitancy, and infectious disease, and serves as the chief medical officer at Serious Fun Children's Network and as the medical director at Camp Winnebago. She's also served as the medical advisor for the American Camp Association, and she's on our advisory group here at the Alliance for Camp Health. And I know every single time I sit down in a conversation with Laura, I feel like I learn something new that challenges my way of thinking. And I believe that will be true for both Laura and for Tracey today. Before the three of us move too far into the dialogue and discussion about all the things that we are passionate about here at Elevate and Relate, we start out with a camp-friendly joke. So this is one of my most favorite kind of little moments as we get underway. What do you all have for us today?
So this is, it's not directly camp related, but this is one of my favorite camp appropriate jokes. So there are two snakes talking to one another, and one snake says to the other snake, "Are we poisonous?" And the other snake says, "Well, gosh, I don't know why." The other snake says, "'Cause I just bit my tongue." You're welcome.
I appreciate that. I don't think anyone's going to be biting their tongue here in the midst of this, because I know that you both speak openly, honestly, truthfully, based upon what the science is telling us. And so no biting of tongues here. Tracey, do you have anything to add?
So all of my jokes are animal jokes. So I would say, what did the beaver say to the tree?
I don't know.
Nice knowing you.
Very nice, Tracey. Yeah. Well done.
Tell one more.
Yeah, please.
What
please
do you call a group of grizzly bears telling jokes? A barrel of laughs.
Well, we could keep going with that all day, I'm sure, but there's a lot more information that I know camp owners, executives, and especially healthcare providers and behavioral health specialists are are excited to hear about as we head into the summer from you all because of the ways in which you bring such relevant guidance. I wish that a couple decades ago when my career in the space started that I could have leaned on you all for guidance like you're about to offer today. So when we think about the things that are ahead of us and the trends that we are seeing that continue to populate the headlines, we know that there's a lot of health related pieces, but I'm curious if we start with something that's on most camp health professionals' radars as we move through this spring. We've seen some unusual patterns with respiratory illnesses surfacing. I'm wondering if you all can walk us through what's been circulating and why, as a camp director or a healthcare provider at camp, this matters to me.
Yeah, I think respiratory illnesses matter to camps a great deal. One, because a lot of respiratory viruses are communicably transmitted, and the camp environment through coughing and sneezing. We all have the camp crud within 2 to 5 days after the arrival of new campers. So these are viruses, right? So there's the common cold viruses. There's the camp crud that kind of comes and spreads through. Whether you're a day camp or whether you are an overnight camp. We do see this every year. Certainly there are some viruses that have names and we pay attention to them because the profile of their illness is more than just the 2 to 5 days of sniffles and low grade fevers. Some of those viruses that have changed in the wake of the pandemic and their seasonality, flu, influenza. So we had a very robust flu season this year, both flu A and flu B. It was a flu virus that had a little bit more mortality and morbidity in the pediatric population, meaning that it made kids really sick. We saw a lot of kids in the hospital, and the way that the flu had mutated away from the kind of robust protection that the flu shot had given. So we're going to continue to want to look at flu. The RSV season, respiratory syncytial virus, is a disease that mostly younger children have severe response to in terms of hospitalizations, but it is one of those colds that just kind of stays longer than other colds. And that season was much later this year. In fact, the CDC recommended giving the protective shot to infants much later this year until the end of April. We are still seeing a little RSV. So for most camp age kids, John, that would be like a cold that just is a little more lingering and lasts a little bit longer. I think, there are some other, there's certainly other respiratory diseases like walking pneumonia, those sorts of things. But it is really just those respiratory illnesses like RSV and flu. And, COVID is still out there. So I think we have to remember that that's out there. The question is, I think a lot of people ask is like, do I need to know? Do I need to know that it's RSV? Do I need to know that it's flu? Do I need to know if it's pneumonia or COVID? For most common colds, we don't test, right? We just say it's a common cold. But there are like the RSVs and the flus, they do tend to last longer, which confuses us in health, in camp healthcare, because you think the kids should be turning the corner and they're not. They're still sitting in the health center or they're still not showing up. So and those illnesses do end up with more like secondary infections at the end. So for those two, it would be worth either sending the kid in to get a swab or to determine those. But generally, Tracey, in camp, I give the kids the time, to kind of get over their cold. If you're heading into 3 to 4 days of serious coughing and fevers, then you should probably figure out which of the viral flavors it is.
Yeah, Laura, thank you very much for that. I think it's interesting. I know that so much of the industry, the field, healthcare providers, camp leaders leaned on both of you during COVID for continued guidance and what that looked like. So I think back to respiratory related matters being transmitted, and there was a great deal of concern to be able to name like this is COVID and to test it and to kind of identify it. So I appreciate the delineation to say, yeah, like ultimately the symptoms matter, and what you're trying to track is ultimately knowing how you're going to provide care for what it is that's happening, and depending on the length of the session that you may be running, and how that's impacting the potential for spread, regardless of if it's what was COVID, but if it's RSV or others. So Tracey, I'm wondering with some of that, what does this actually look like on the ground, right? For a camp nurse or health director, what should they be asking to potentially prevent, to get in front of on a check-in day from a screening or health form standpoint?
Well, let me just say the intro you made was very kind. And I always say, Laura and I are blessed to do the work we do every day. We get up and go at it in a way that you hope in some small step that we do that we're making an impact on youth across the country. That's what motivates both of us. We've been together. Sound like we're married. We know we're not. We've been working together for
Some of those COVID days, it felt like it.
yeah, for many years. So the ability to navigate this avenue and this work with other folks who are invested is just such a gift and a blessing. So it's always fun to come together. And that's kind of what happens when we come to camp, right? Kids are always excited to get to camp. Families are typically excited for their kids to have time away at camp. And the language we like to use and we continue to push is we want your child to arrive to camp in a healthy state. Now, what the heck does that really mean? And so each camp, I encourage them to say, what does that look like for your camp? Because it is different. And the diversity of camp makes it different. We want kids to arrive without the respiratory symptoms that Dr. Blaisdell's mentioned. We want them to arrive ready to go and not completely washed out and fatigued from wherever they were last week. And identifying that is super helpful for families, because if you just say, make sure your kids are healthy before they come to camp, they're going to interpret that probably 15 different ways. So arriving to camp in a healthy state is a great way to kind of educate families, and putting that on your website or sending that out after an application can be super helpful, so that once their kids applied, you can say, here's how you can help us set your child up for success at camp. We want every child to have a successful experience, but if they arrive completely washed out from school or other experience or feeling ill at the get-go and they're there a week or 10 days, they may not be having the best experience. So that's a really important piece to me. I think Dr. Blaisdell touched on another piece when we're talking about when is it just the cold. And most of the time, if it's a 3 or 4 day viral symptoms, it really doesn't need to be named, because you're going to treat viral illnesses for the most part the same way. Symptomatic treatment. The condition becomes then, well, how do we know when it's more severe, Tracey? Well, I say sometimes it's in numbers. Sometimes it's, hey, it's 1 or 2 kids with a respiratory illness. Holy moly, it's the whole cabin with a respiratory illness, and people are not getting better in a time frame that seems reasonable to you. So there's not a hard and fast rule to say, on day 4, if people are not well, then you need to do something. There's not a hard and fast rule, but numbers of people will tell you, raise your awareness. Severity of how they're feeling will raise your awareness. We all know kids are pretty darn resilient, and they don't want to be down and out. So they're going to push through even when they don't feel well to get to participate in camp. So if they're coming to you and saying, I feel bad and I don't want to do this, most of the time they do feel pretty bad. Whether it's physical or mental, emotional, social, we need to address those things. The last thing I would say is just, how are we communicating with families? What is that bridge of, like, again, what information are we giving them to say, have your child arrive to camp in a healthy state? Here's what that looks like at camp, Happy Grounds, whatever the name is, and give them some guidance around that. There's also resources and tools that say these are healthy activities you can discuss with your child before they ever come to camp, so that every night you have a 2 or 3 minute conversation prepping your child or youth for that camp experience. And that just sets the tone for really a great camp environment for not just that individual, but for everybody.
I love the framing of a healthy state when we're trying to process the care and the provision of care that we're all trying to offer, right? When we look at every single staff member that's present as a part of the health services team, everyone has a responsibility to be assessing what that looks like to create a healthy ecosystem or community immunity type of piece. That's language, I believe, Laura, I learned first from you when trying to understand some of the vaccination related pieces. And that's actually, I was on a call the other day with a camp owner director in Colorado, and they were like, do you know, like, are we really facing some pieces around vaccine policy that we need to be concerned about? And I was like, where's that coming from? But I was thinking about this time and jumping into this call and having this recording, and want to know, let's ask, what do camps need to know about vaccine policy? And knowing, Laura, that you've been someone who's been leading that for the American Academy of Pediatrics in Maine and beyond across the country, I'd love to know what your thoughts are.
Small question.
Yeah, right. So it's just a small question. So when we head into camp policy or camp vaccine policy, I think it's really important. I like to come out with the headline that the vast, vast majority of Americans are still vaccinating their kids on the schedule according to the American Academy of Pediatrics. So you're not alone if you're vaccinating your kids with what your pediatricians recommend. There is this sort of heightened sense of contentiousness, right, about vaccines. And it's also, I think, important to also know that, not all vaccines are the same in terms of their importance in a communicable disease settings. There are certain vaccines that are more for the individual to protect themselves, and there are vaccines that are really important. They're what we do to protect our community. So coming into this conversation as a camp director or camp medical professional is really important to try to step away from the black and white thinking of I'm pro-vaccine or I'm anti-vaccine, right? So it's a real helpful framework to come into this space. And it probably isn't truly reflective of the risk that we need to convey in the camp setting to not come into this space with a little bit of more of an open mindset. That being said, both Tracey and I feel very strongly that there are some vaccines that are pretty essential to protect your camp. And when we talk about camp, wearing not only the camp medical perspective that it's dangerous for the kid and it's dangerous for the kid that might contract that disease, like let's say measles from another child. It's also dangerous. It threatens operations. It threatens your viability of a camp in the same way that COVID did. So I think it's really important to realize that, a measles outbreak in a camp is really going to shut that camp down for the season. And, the reputational risks of that as well are important to consider. Thinking about beyond simply the health and well-being of your campers, which is paramount. When we look at vaccine policy, it varies state to state. We don't have a national vaccine requirement. And when people talk about mandates versus requirements, these are requirements for camp entry or requirements for school entry. We don't have vaccine mandates in this country, which would mean you don't have a choice. So I think it's really important, the verbiage like community immunity, John, that we talked about before, using the right verbiage that these are requirements for camp entry. This is a requirement to be part of our community. This is not a mandate. I'm not saying you have to do this. I'm just saying that in our community, we're vaccinated against measles. How do you feel about that? And so that's a good framework for approaching a lot of things. Like, how do you feel working in a non-smoking environment? How do you feel working in an environment where pick your poison, right? So as camps look at what they're allowed to require for their camp session, it's important to look at your state and local public health laws, right? So each state is going to be different about whether or not those vaccine requirements are going to align with school requirements, whether you can actually, as a private nonprofit organization, require vaccines for entry into your program. So working with your state or camp legal representation to understand those laws is really important. One other aspect about a vaccine policy that's important to understand is exemptions, right? So that's who can choose legally to not have a vaccine. And certainly Tracey and I as practitioners we never want to give a vaccine to somebody who can't have one medically, right? There are people who can't receive vaccines. So those individuals are certainly always going to be exempt, right, from vaccine policy, and should be able to attend camp programs, even if they have a medical exemption for measles vaccine, for instance. So what states have in addition to medical exemptions are philosophical exemptions, which are kind of like, I just don't want to, or religious exemptions, which have always been a particularly confusing exemption to me because there are no major religions that advise against vaccination. And so, whether or not that's more of a philosophical belief or not has been argued in this space. But regardless, having those exemptions in your state means that there's a process for parents to show a form or just choose not to vaccinate, and they can do so legally under the vaccine law of any particular state. So it's really important to understand your state milieu, your vaccine policy milieu that you're operating in.
Can I add to
Tracey,
that?
yes, please, go ahead.
I was just going to say, And I think all of those points that Dr. Blaisdell is highlighting is exactly why you need something written as a vaccine policy for your camp. So as your healthcare providers are there, or maybe you don't have healthcare providers, everybody needs to understand what is allowed, what's not allowed, and there's not a different decision for each individual of being that's approaching you to say, well, I don't know if I want to do vaccinations or not, or I don't want to, or yes, I want to. So the same requirements play out for individuals. So it makes sense. Otherwise, your people reviewing your health forms are not going to know what to do. They're going to be at a lack of direction regarding, well, this camper's application has no vaccines. This one's fully vaccinated. This one's somewhere in the middle. How do I know which is appropriate and which is not? So having some form of policy and procedure around whatever your vaccine policy is, because it will be different state to state. Dr. Blaisdell's right on target about what that looks like. But that may require a little research on your part to say what is allowed in my state.
So what I'm hearing is, depending on what state and what part of the country I'm in, there's definitely a need for me to do, if I'm a camp director, research and working with my medical director or healthcare provider that's going to be in the health center. We need to do our due diligence. And then the conversation that I'm hearing as well, Dr. Blaisdell, is that this is not a conversation that's a to vaccinate or not to vaccinate. And I believe you've done research in this around vaccine hesitancy, and that's not the question at this point in time. What I'm hearing is, what will make our community safe, and how are we elevating care so that we can relate in the space with one another in the community better. And I know we could do a whole entire podcast specifically on this, and we've got lots of items as we head into summer of 26 we want to focus on, but I think I'm trying to figure out what's the best way to synthesize this conversation for a medical director or healthcare director at a camp, and the camp owner leader who needs to have responsibility as well.
I think it's really important. And sometimes I wish, Tracey, that I was non-medical, because it feels like I might be able to approach this vaccine conversation in a very different way. For camp directors and non-medical folks to say, this is to focus just on what you were saying. This is what we do to protect our community. This is what we do because it's aligned with our values. This is what we do because we believe that this protects the continuity of the camp experience. So that's the camp director's answers. And a lot of people want to get into the medical, but have you heard about toxins, or have you heard about side effects from these vaccines? And I would caution camp directors, and this is why I say I wish sometimes I wasn't medical, because camp directors can say, that's not my lane. I do trust the pediatricians who are recommending these vaccines. I do trust my camp medical staff who are saying that this is important. So I really can't get into that with you, but my job is to make sure that our community is protected. And I do understand that this might not be the camp for you, and that might be okay. That's particularly challenging as we're trying to fill beds and run a business. But I think it's okay to say, I understand your point, and this might not be the camp for you. I also understand that often parents will say, okay, fine. They'll find a different camp opportunity. Yeah. I think, And then, for camp medical professionals, I would say, not taking this black and white approach to vaccinations, like really think about, what are the vaccines that you really want people to have? HPV is a virus that's transmitted sexually. Like, is that the vaccine that you want to mandate for your camp? That's a question. But I would say, Tracey, the top ones that we always talk about: measles, mumps, rubella. We're having outbreaks, we know, in this country and across the world. So measles, mumps, rubella, the pertussis vaccine is also very important. There are other ones, but those are kind of the ones that kind of hit the highlights for me.
For sure.
Laura, thank you. We're going to change gears to keep kind of going with all the different pieces here. So Tracey, want to come in your direction at this point with what is probably the most prominent, significant piece of our work at ACH, it seems like every spring, and that's medication management. We know that there's some different wrinkles that surface each year, or some different challenges, but there's some pieces that are consistent. What are the questions that we've been getting? I know our inbox has been filled with questions specifically around medication management and the courses and specific requirements, and what's new in this conversation that we need to be considering coming into summer 20.
I think I'll preface my answer with, how lucky are we? How lucky are we to be in a space where we have access to supplements and vitamins and herbals and FDA approved medications, and still almost daily, sometimes it feels like, new items on the market that are like, how is this helpful? What is it used for? And gives people the opportunity really to do a little self-education. We know people use Dr. Google. We understand that, and that's something we work with and talk about all the time. But ideally, the questions are coming into, what is it that my child can safely take at camp? That is really the question I would ask and encourage families and healthcare providers and camp leaders to think about. What are those medications that we can either safely administer at camp, have the capacity, and capacity is a unique word, meaning do you have the right credentialed people to oversee those type of medications? And then what is it we want to do to safely give medications in a way that we have a good process in place? So the questions around medications all come back to, what is medication at your camp? And people who've heard me talk about medications have heard me say this many times, because if you can't define medication at your camp, it's a really hard starting point to know how to provide direction and guidance to families, to others, but to say, what is medication at your camp? Now, if I'm running a camp, I might say, I only give FDA approved medications. That could be my definition. And Dr. Blaisdell might say, we give anything that improves health. Well, now she's opened the door really wide. She may be willing to do that because guess what? She serves special needs who are on a lot of different substances, agents, and I won't call them all medications because they may not be, quote, FDA approved, but are helpful to a child with a particular condition. You need to just analyze what that looks like for your camp. Have a definition of what medication is at your camp. Then that allows your healthcare staff, whoever that might be. For some camps, that's CPR, first aid folks. For others, that's maybe a nurse or two. For others, that's a really robust health team. Know what your definition is, and then your healthcare staff who will be providing that service will be able to fully align with what they need to do to keep people safe in this process. If you're going to allow things like herbals, homeopathics, supplements that maybe people aren't really familiar with, just remember you need to know legally that your credentialed staff are responsible for knowing side effects, adverse events, potential drug interactions. And if they come and they don't know what the substance or agent is, and we're giving that alongside of another medication, they're still legally responsible for that experience because they're administering something as, quote, part of your definition of medication. So I just kind of highlight that because that's a key piece. We write things at ACH around different substances. Like we did a e-blast around Cramton, which is the new substance in some of the energy type drinks. That's something to think about. People may be coming, your staff may be coming, drinking something with Cramton in it, and you're like, I have no idea and I'm not unaware, but I don't know why this staff member is maybe hyperactive or acting in a different way than they have before. So understanding medication from the concept of, yes, those things that are FDA approved and we are all comfortable with, to those things that are coming in energy drinks and other products and supplements and food sources that we may not have a familiarity with. It's just powerful work for us to really think about all those moving parts. Oh, and by the way, you have 2 nurses and 500 kids. So It's such a key piece. It is still one of the most litigated things from a camp experience. I had a kid last summer that I got a phone call on. The child had been at camp for 4 weeks and he got the wrong medication all 4 weeks. So where was the breakdown in that process, right, that created that scenario where this child got the same medication all 4 weeks? Maybe it was someone who wasn't credentialed, wasn't a nurse, had not had experience in that, and just gave the same blue-colored pill every day because that's what they thought they were to do. So I don't know the details of the story, but I think I use that as an example of how things can come off the rails pretty quickly if you don't have the people paying attention in a way that's really helpful. There is a lot of stuff around controlled substances, marijuana, CBD, that kind of all fits in that herbal homeopathic category. So you have to decide, are you allowing those type of medications as well? Many camps use medical standing orders, which helps guide some of that medication administration process. It can be very helpful. And having a prescriber look at those every year, review those every year. And I would say the key piece about medical standing orders is to have a component in there around assessment. Now, if Dr. Blaisdell or I, either one, going to see a patient in a room, we just don't go in and say, "Hey, patient John, how are you today? What's wrong?" And John says, "I've been throwing up for a week," and I write him a prescription on the spot for what he needs. No, what do? I have 12 other questions. Tell me, and then, so I'm going to dive into that story, and that assessment piece is really a legally helpful component of the work around medications. Asking the dehydration questions, asking have they been in the sun, asking if they've had any chance they've gotten a concussion and that's why their head's hurting. All that plays a really important part in your medication management program. I do want to mention, when we talk about medications real quick, about documentation. One of the most common questions I get about documentation is, well, we just put everybody in the health log, and then that's good. We just write their name. We gave John Hamilton, he came in, he had a headache. So John, headache, Tylenol, and my initials. And that's my entire essence of documentation. Please know that is not a legal document, in the sense of, if you went to court, you would need a lot more information. So you should be documenting the assessment and the care and everything that goes around that simple giving John the Tylenol, because that's where the questions happen when things go sideways and they don't go as planned. They're going to want to know, what did you do in that situation in place of that? So the documentation of an official health record for each and every individual can sit alongside a health log. If you want to use a health log, that's fine. But you should have an official health record for each individual.
Yeah. Tracey, I mean, so many pieces to try to look at, to cover. I think that what I do know is we'll put in, I know we have the medication management FAQ resource that we published last May with Dr. Michael Ambrose. We'll make sure that's in the show notes, as well as a link to our Elevating Care Weekly, which continues to feature SHAPE, safety, health, and prevention education, that our framework around clinical care, some relevant
we have
resources.
A variety of practice guidelines, right, around medication management, and they're all there, and we'll be glad to share those for sure.
One thing I feel like I'm really hearing is that if I'm a director at camp and I'm working with a healthcare provider, the medical director, reviewing and approving the protocols of what's being distributed, and being able to frame that as a part of the prevention and the health promotion for the space, that is just as important as the actual administration of the medication. So that process sounds like it's one that everybody needs to be informed about and in tune with together. Is that accurate?
Dr. Blaisdell can speak to this. You've got to be lockstep with your camp director, right? You've got to be hand in hand. Your camp director and your healthcare lead, your healthcare director, whatever the title might be, need to be communicating regularly, authentically, every day in some way, so that they're on the same page from the moment you start receiving applications all the way through the experience to come on the back end and you're like, okay, let's look at our health log. What are those quality improvement things we need to be doing? I will tell you, at my camp, I had 3 kids who went home with heel fractures from the Green Lodge. And I was like, what? Nobody showed up in my health center with heel fractures. Well, guess what? They were jumping off the top bunk. We know you don't jump off the top bunk onto a concrete floor. But what happened? They did not want to miss the camp activity, so they didn't say anything until they got home. And then they were like, oh, my heel really hurts. And the parents take them in and they have heel fractures. And I'm like, let's have a quality improvement moment here, people.
Yeah, that's good. I want to shift a little bit. I was out on the trails here in New England recently. I'm avid in that space, and we've moved from the season of the sticks, a little Noacon reference, to the season of the ticks. And Emery Major just came out with a sweet little rendition. He's an artist kind of doing a riff that I think so many camp leaders would love. It would make the tick education stick a bit, but we've progressed. And so I'm curious, Dr. Blaisdell, could you help us set the clinical stage for this? What is it that camps should understand about ticks and tick-borne illnesses that are becoming more and more prevalent as we know? And I know we'll have some updates from Tracey as well as it pertains to our Fight the Bite initiative that has been really bringing awareness to this. But could you just set the stage for us on this season of the ticks that we've entered?
Very punny. I appreciate the setup. It used to be that we would think that, we could avoid ticks. And I really think that, that they're just with us. We're going to have to figure out how we use all of our good preventative measures that we know in either public health and medicine, to start to protect ourselves, right? Ticks are going to happen. One of the things that we used to think about ticks is a couple things about ticks. There are ticks and there are ticks. There are different types of ticks, right? So some ticks carry diseases and some ticks do not. The classic dog tick that has, a certain appearance to it, and it blows up to about the size of a grape. That tick is a different type of tick than the deer tick that is almost impossible to see in its nymph stages and will balloon up to looking like a sunflower seed kind of stuck into the skin. That's a different type of tick that does carry a different diseases. Of course, the ticks that are out in the Rockies are a little bit different as well. Regardless of like the geographic area, I think now we're seeing that we need to be aware of all tick-borne diseases because of changing environment and our highly our world in which we're traveling a great deal. So I think Lyme hits the top spot 1, 2, and 3. Lyme disease is it's tricky, right? So the things that are tricky about Lyme are, one is that the bite and the symptoms don't necessarily align temporally. That's one tricky piece, meaning that the symptoms of Lyme often show up weeks to several weeks later. And the typical, just the bullseye rash that people look for is sometimes missed. And so that's one tricky part. The other tricky part is that sometimes we don't know that the tick bit us. And so we don't have the tick bite, but then we have a strange rash. And also it's tricky because you actually, and to prevent tick bites, you have to do things like, the physical environment of camp can be changed to not have high level of grasses. There are some sorts of preventative measures that camp environments can do. But we as people, whenever we require people as part of our preventative process, there's opportunity to miss, right? So they're wearing tall socks, doing tick checks on a daily basis, using those sorts of preventative things like permethrin or DEET, and then washing them off appropriately. These are all hard things to do consistently within the camp environment, but they can be done. So inserting tick checks as part of the cabin check, like when you do that hospital corner, you should think hospital corner tick. Hospital corner, tick. Sweeping the stairs, tick. So when you have that cabin check or every morning, we need to be looking for ticks. They love those dark spaces, right? They like armpits. They like the tops of pants where they can finally crawl up the pant and get in, or the bottom of jean shorts or of shorts. So that's something that we have to talk with our staff about how do you do a tick check on a kid that's thorough, but also respects privacy, right? Those are those two things that we're balancing when we're doing tick checks. The other piece is communication with parents. So if you have a day camp or if your session ends, Lyme will often show up later. And so communicating to parents that we are in an endemic area, we didn't miss something by not picking up the Lyme or not telling you that a tick was on your child, but we're now passing the responsibility from continuing to monitor for Lyme disease to you, educating parents about what those monitoring signs and symptoms are. I think from a health systems standpoint, if you are a camp nurse or a camp medical professional, keeping a log of the kids that you pulled ticks off of is very helpful. And knowing that you're going to go back to that within 2 to 4 weeks and ensure that that kid doesn't have any rashes or any symptoms of Lyme. And also perhaps sending a note home to the family saying, hey, I pulled a tick off Tracey on July 7th. Just wanted to let you know to continue to monitor for symptoms of Lyme. I won't say a lot, John, right now about all of those other diseases like alpha-gal and our inability to eat meat. These things get a lot of hype in the media. There's babesiosis, there's ehrlichiosis, there's anaplasmosis. These are all diseases that can run in ticks, but I think that's probably too much for this topic right now. But Lyme is where I would say to have people really focus on managing ticks and Lyme. Tracey, do you have any ideas of how we can prevent getting bitten in the first place?
Oh gosh.
Sorry, John, I'm cutting you out of this conversation.
Dr. Blaisdell, those other diseases are kind of fun to say. Like, I say
Osis.
ehrlichiosis and babyosis, and people are like, what is that? I'm like, I know. It rolls off the tongue almost like a good Italian dish or something.
That's right. It's like, babesiosis.
That's right.
We're going back to the joke portion of the show.
And all of that information Dr. Blaisdell just shared is so important, because this is exactly why the Alliance for Camp Health has a program with SC Johnson in the year 3 now. We had a pilot year 1, regional emphasis in year 2. And now we have a national expansion of the program where we are reaching out to camps across the country to say, come join us. Let us do the work to set you up for success. Let ACH partner with you in a way that helps you monitor tick encounters, monitor tick bites, have a way to do that so that you're getting that information. We will be your reminding person. We'll send you something every week that says, hey, let us know about tick bites and tick encounters. That's helpful to us. We've been fortunate as part of this program to work with the CDC over the last 3 years, navigating this work. They have been super helpful in reviewing documents and leaning into documents. So if a child were to have a tick encounter or a tick bite at camp, we have a form that you can easily fill out in this program called a transition of care form. You outline all the care you gave at camp and you send that home with the child, and it reminds the parent, continue to monitor, as Dr. Blaisdell said, continue to monitor the child. Could be 30 days later before you see something. So be aware of that. Here's, if we did do treatment at camp, here's the treatment we did. Here's the date we did that. And then the program really helps people come full circle around all the prevention measures. So we have all that ready for camps, and we would love for camps to engage and let us do the work for you. You just enroll and we send you everything, things to train your staff, things to train your healthcare team, information to give families so you can educate them before that child ever steps on your site. Like, hello, we're an endemic site. What does that mean? Believe it or not, many of the camps in the U.S. are in endemic locations. Where John and Dr. Blaisdell sit right now is one of those lovely spaces. So I always say, it's not bad to say we're in an endemic area. It helps parents prepare their youth, teach them to do prevention things, teach them at home about tick checks before they ever get there. We say, hang a mirror inside the bathroom stall. So when a child goes to the bathroom, here's an opportunity for them to look at spaces and places that they may not be comfortable having someone else examine. But there's all kinds of ways to do really good tick checks, do good prevention work, and let ACH come alongside you to help you navigate that space, because we want everybody to feel comfortable managing and working in the tick space, because we know kids being in the outdoors is irreplaceable. So let us help you in any way that we can. And there's plenty of information on our website about the Fight the Bite Tick program with SC Johnson.
Tracey, I was on a call the other day with a camp director down in North Carolina, and they were like, is it too late to sign up? I heard there's free resources about ticks for our summer staff as well as for our healthcare providers. Is it too late?
It only takes you 2 seconds to go to the website and sign up, and we will get everything to you right away. No cost to you, all the resources and information. So please keep signing up. We've had a large number of camps sign up for the program, and we'll continue to reach out and try to encourage folks in different regions. I know it's harder for regions who historically have said, we don't have ticks here. Why do we need to join this program? We're not tick people. We're not endemic. And I say the CDC has identified ticks in every county in the country. Now, yours may not be as robust as where Dr. Blaisdell and John sit right now, but ticks are there. And you just want to at least have some awareness, if nothing else, about what that looks like, how to have kids and staff doing good tick checks, and just doing our due diligence to keep people healthy at camp.
Something I know that you both have brought up that was really significant in our pilot program year when we were in Wisconsin. And I remember being there on site at a camp and listening to summer staff go, oh, having this education reduces my concern, my worry, my fears that I had if I saw a tick on one of our participants in the program. And then hearing a camp director say, oh, I feel like I have more of an understanding about why I can be passing along this communication to a caregiver, to a parent, so they can bring this information back to their pediatrician. And I was like, gosh, when I was directing camp in Northern California, I was not thinking through that connection of the dots, so to speak, in the ways in which you both have laid out, and the program is helping to identify. So I really appreciate that. I want to just come into something that's a little bit different at this point in time is I was on a call with one of our board members recently as a nurse, and they were saying, "Hey, so we've hired another incredible nurse to join our team this summer." And I'm thinking about camp directors who might be asking the same question. How do I integrate this individual who brings a really unique scope of practice into the camp life? How do we move the camp healthcare providers out of resting solely in the health center where every bump, bruise, band-aid needs to be applied and everything funnels to this one individual, two individuals for 500 campers, as you identified, Tracey? How do we integrate them into all of the health services, and how do we bring all of the summer staff and everybody else to be a part of that through this staff training season?
So many ways. There's so many ways. Trying to narrow that answer down, and Dr. Blaisdell has vast experience in this work as well because she leads a big healthcare team and what that looks like. And I say, we try very hard to move from a reactive posture to a very proactive approach. So people laugh at me because when I hear people say infirmary anymore, I kind of get a little twitch in my face. Like, infirmed means ill and sick. It means, like, I go back to the days of like when people had TB. Yeah, kids are not infirmed. We are got healthy, robust, lively, lovely people that we're taking care of. So how do we rephrase that and reframe not only our language around health center so that people go, oh, we're not just treating the Band-Aid, as you pointed out, but we're actually promoting health here. And the way to promote health is not just physical, it's mental, emotional, social for all of us. So all of us want to, if we're going to spend our time and energy doing something, it's helpful for us to have a voice in that process. And when somebody new comes in, they come in with fresh eyes. So anytime you have someone new come in, say, we really want to hear your feedback. What are some of your first impressions about how we brought you in and some of the orientation pieces we did? What are some of the pieces you think might be missing from the work we're doing? And they're going to give you a perspective of like, golly, geez, y'all brought me in and I've been in this health center, I feel like, for the last 7 days and can't hardly breathe because I haven't really been away more than 25 feet from the health center because I sleep here, I do everything but eat here, and I treat people here. Wouldn't it be nice if I could get out and go have a walk? And you're like, oh, well, we meant for you to go have a walk and we didn't teach you that. Oh, yeah. So I think that's a key piece is how do we make them feel part of the community? They are just not a stop-in shop. We want you to go out. And I love when I see camps have a thing called a mobile clinic. They've either decorated a golf cart or they've done something. They put like, where are the first aid people or where are the health team? And they go out to where the kids and the staff are and treat them there. And help people realize that even if they have a chronic condition, and Dr. Blaisdell can speak to that, we want to keep them in the activities. We want to keep them doing everything they can do and not feel like, oh, one more time I have to leave what I was doing, go to the, quote, hospital or health center at camp and miss out because of my health status or health condition. How do we rethink about how we do health services? We're really good at doing blood sugar checks at the fishing dock. We're like rock solid because we know how important it is for kids not to have to leave fishing to do what they want to do. So think about how you can integrate that individual into the camp experience in a way that we may not think that it's really important for them to get to know the staff, but I can tell you it's invaluable for them to know the staff. Dr. Blaisdell and I both say, who's on your healthcare team? Everyone. Yeah.
And in addition to that mobile clinic, Tracey, one thing I really do recommend is having a time just to going around to the cabins. Like if there's a rest hour, pick a time every week that you just go around with nail clippers and Band-Aids and some antibiotic ointment and maybe some eczema cream. And just, we see things through the medical lens that people might not pick up, and so we know that our health staff is often young and they're busy and kids want to be back into their activities. So doing a quick check, like sometimes in camps that I've been in, I'll walk around and I'll say, okay, the kids know the shoes are off. They're in shorts. We're at boys camp, so they don't have a shirt on. And I just take a quick peek. I say, okay, turn around, let's see your legs. Let's see your toenails. Let's see your teeth. Are you using your toothpaste? So there is a role for being mobile outside the health clinic for preventative. And I always find something, right? Wow. I always find a kid that I'm like, what is that scrape? Why have you been letting that ooze? And you might have those heel fractures if you had been there to witness the jump.
And what I hear you saying is risk management. That's
Yes.
exactly what you're doing. You're catching things, heading it off at the pass. And so the poor kid who's worn a wet bathing suit for 3 days and now their legs are so chapped they can hardly stand. If you catch that early, you can prevent a lot of painful experiences. I mean, that can be significantly painful. So I love that idea of like, we call it risk management, risk mitigation. We just know we're going out and checking on people and loving on people where they are and meeting them where they are. And that is a really important risk management activity. So I love that you mentioned that in a way that makes sense to folks.
Last question before we move into our kind of closing segment of elevating care and being able to elevate and relate. This last question is just maybe if you can each just touch upon a little bit from a documentation and compliance standpoint. What is it that some of the best in class, best in practice, shape clinical care camps, what are they doing that others could be learning from?
Goodness. I would say, if you say, what are the best in class doing? They're learning from what they're documenting. They're learning from documentation patterns, methods, language. So they're not just putting things in a document never to be seen again and be held away in a dark computer somewhere. They're saying, hey, let's go back and revisit the things we saw this summer, the experiences we had this summer, what went well, what could we do differently? Because you always need to have on the lens of, how are we improving? How are we changing? Because stagnant means you're moving backwards. And we all tend to hear that saying a lot. So how do we take what we're actually documenting and not forgetting, and I call it the nursing process, assessment, intervention, evaluation, not forgetting those key pieces. Sometimes when people put on the shorts and the t-shirt, they forget that the same rules that apply to them in the hospital also apply in the camp setting, even though they're in the same state. And so I say, don't forget, those legal pieces are still in place. So in the documentation space, documenting your assessment really well, documenting what you're doing. And then if you intervene for someone, there's a requirement that you go back and make sure that they got better. If Laura goes down on mobile clinic and puts Band-Aids on kids or treats some scratches, she has a responsibility to go back and make sure that they're not worse, at least not worse, but at least hopefully a little better. That's called therapeutic effect. And we should be documenting therapeutic effect in simple ways, a check mark, a thumbs up across the dining hall that a kid's headache is better. You don't have to go do a full assessment, but you do need to check in and say, how are you, John? Are you better? Stomach feels better? All good? We gave you some Tums, whatever we did. And that's a really important piece that gets missed quite often. It's hard in the camp setting. People are everywhere. They're always moving. But putting that on your radar can be hugely helpful.
I
Laura,
couldn't
anything
agree
you'd
more.
add?
Tracy. Yeah, I think a couple of things. One, John, you and Tracy have talked about the continuum of care that camp is, right? And so not only over the course of a summer, so I'll just say the continuum of care over the course of the summer is making sure that you're reviewing medical visits to the health center to see any sort of progression or things that you're missing, right? So somebody in your organization should be like, should be looking over the last week of one kid. Why has Tracey come in 3 times? Is it homesickness? Probably. That's the most common reason. But could it be that, she's developing a urinary tract infection? We don't know, but we need to be curious about those kids who are showing up at the health center multiple times. I think that's one of the reasons I do like the ACA health clinical log. It's not big, right? Like it's very small, but it does allow me to look over time. And so, if you're just putting on a Band-Aid, just giving Tylenol, if you give Tylenol and now you're giving cough medicine and now you treating a fever, the same person, that's important to notice. I think the other piece is then the continuity of care. We've already mentioned it with Lyme, is making sure to communicate before camp and after camp to caregivers and guardians about what you have at camp and what you saw at camp. And then lastly, I would just say that, when the ACA health log, which I really enjoy because you can look over many kids who are visiting, but when a kid does visit for something that you're doing a deeper evaluation of, make sure you pull out a SOAP note, the sort of, what we call subjective, objective assessment and plan note. Make sure that you're documenting what you're thinking. Like, I think it's this. But if it doesn't act like this, then I told the camper and the camp director, that this child needs to return. So that sort of documentation is, we're not always going to get everything right on the first time you see something. And that's true for me as a pediatrician, Tracey as a practitioner. But what is excellent about the care that we provide is when I write, I think this is a viral syndrome. A viral syndrome should act like this. If it doesn't act like this child needs to come back and see me so that I can reevaluate for something else. And that was communicated to the child and to their counselor. That's what keeps us in this sort of like excellent care in camp, in the continuum of camp. So I really appreciate what you said, Tracey, but and also thinking about we're not a healthcare facility, but we need to continue to document and share what's on the back of our mind so that when we look back to the next nurse that comes in, the next doc that comes in, we can look back and say, oh, this is what they were thinking.
Got to tell the story, right? We all know in documentation, tell the story so that everybody can follow that in some way, so that in 20 years, you can go back and know what you were thinking.
Help your future self. That's what I tell them. Help your future self by telling your future self what you would do next.
Yes, exactly.
But there's something so powerful to recognize that information is any information is better than no information at all, right? And whether or not I always think about that, if you're going to pass information along via communication, you can't do anything with nothing. If you don't have anything that's there to start with, then there's no basis. And so I really value where both of you are coming at. It sets the stage for this kind of final segment before we get to wrap up our time together today and continue to move toward the summer of 2026. And that is just, you both are identifying ways to elevate care. And so if we're looking at this final segment here, I want to know what each of you would do to look at one or two actionable things that you both are looking, because I know you're not just thinking about these things and writing policies. You both are practitioners. You're in the work as well with us, and I love and appreciate that so much. That's on a daily within your clinics, and that's both at camp this summer. What's one or two actionable things that you both are looking to do this summer that will elevate care in the scope of your practice?
I think one of the things that I'm starting to see in the medical specialty space, and also in the non-medical specialty camping, is data-driven decisions. And so as we lose our complacency for being stagnant, right? We want to be better. We want to learn. We want to grow. It's important to think about what are the things that we're going to measure this summer that are going to help us grow and change and be better and safer. So for some camps, that could just be like sentinel events. Like, did you have anaphylaxis in your camp? And if so, maybe doing like a little bit of a deep dive into what were the situations around that and how can we prevent that in the future. Maybe it's about medication errors, Tracey. We were talking about a little bit about that earlier. It's very common to have medication error, both in the hospital setting and with the robust protections that we have against medical errors in the hospital setting, they still happen. In the camp setting, it's even easier to have medical errors. So tracking those medical errors in a data-driven way, and how did they happen? Being curious about that, having an evaluation of those errors so that you can change and grow next time. That's the one thing that I'm focusing on this summer is with this environment of wanting to improve, collecting some data. Now that sounds pretty overwhelming, I think, to a lot of camp directors and health staff, but data is not overwhelming. Data is a piece of paper that we write, med error, multivitamin not given, camper didn't show up, no following up. That's data. Right. And so it's not an Excel spreadsheet or SAS or statistics. It really is just writing down something that you want to change and then looking at it periodically and changing your approach to that. So I just want to demystify data.
So you didn't use the word research, so you didn't make it scary. So that's
right.
good.
Well,
right?
Yeah, we won't. Don't do research. Just write it down on a piece of paper.
Right. Oh gosh, I have two things. I'm trying to decide which one. I guess there's two things I would really like to think about much more intentionally. Not that we don't do it now, but I think every camp does screening. But I think we always need to revisit the screening. Remember how we changed screening during COVID? Holy moly, we had people in cars. They didn't get out of the car to a certain point. And some camps are still doing that. They found it so beneficial. They're still doing that. So screening, pre-screening, arrival screening, and ongoing screening are really helpful tools. Again, if you want me to use the word risk mitigating activities, that's really what we're doing. But what we're saying is, how do we have people arrive to camp in a healthy state, be well when they walk in the door, and continue to be well throughout the experience? And again, mentally, emotionally, socially, physically, all of those pieces. And there's really simple ways to do intentional screening that it doesn't, like, you don't have to make it an activity in your program. It can happen on your way to breakfast each morning. It can happen, of course, on arrival day when you check in and having some people just maybe having conversation with kids. So they're beginning to get acclimated to the environment. So there's ways to do screening much more intentionally. And I think we need to revisit that every year. We re-sign our medical standing orders each year as a requirement. Now, why don't we revisit our screening practices to make sure that it's still true for the experiences and the events and the conditions that we're thinking about today? So that's a piece. And then delegation is another small piece around, especially for smaller camps who don't have big health teams. How are we delegating care? It's really easy just to say, hey, there's Laura, the counselor. Let me just give her the camper's pills because I don't want to walk all the way down the lake and she's already going there. So Laura, will you give Sam his pills when you get down to the lake? Right? So how does that delegation piece really important? Because Laura's just a counselor and she's 18 and she doesn't know anything about medications. What does she do if something goes wrong? How does she know the process for giving medications? All those things. So it is a real kind of natural habit out of kindness and courtesy to help. Laura might say, okay, but she really has no idea what she's supposed to be doing in that space. So having clear delegation guidelines can be super helpful to everyone.
And if there's a resource that you've already mentioned or a resource that you would lean on as well, if I'm thinking, listening to this podcast in the car or while I'm sitting in the health center, like organizing things and learning, what's the resource that you would point people to? I think, Laura, you've already mentioned kind of the health log from ACA. Tracey, you've mentioned kind of our Elevating Care Weekly that's continuing to bring relevant clinical care out through our SHAPE framework. What would be one or two resources that you'd say moving through summer that you're going to lean on this summer?
I can go easily on that.
I'll let you go. I'm just going to say the AAP, the American Academy of Pediatrics vaccine recommended schedule.
Yes.
There are questions now about what's recommended and what's not. The American Academy of Pediatrics has a vaccine schedule that's been reviewed by pediatricians and infectious disease pediatricians. So that would be where I would send folks for vaccine questions.
For sure. I would say we have a new Writing Your Camp Health Policies document that helps camps navigate writing policies, and that's been a really well-received tool. We have practice guidelines for all of the most common things at camp: medication management, communicable disease, delegation, screening, documentation, that helps camps navigate and create their own policy procedure guidance. So we want to do everything we can to provide guidance documents and things and help them think about all the moving parts related to their health services model. So anything on the website, take it and use it. We want you to have it. And then there's lots of resources also in the camp store.
Awesome. I just want to say thank you to both of you for the ways in which you reflect. The mission here at ACH for us is to elevate care for healthier communities. And I know that the care that you've provided to me, the care that you provide to each and every single person that you encounter, the care that you bring to this conversation will change the ways in which so many others are going to be able to provide care as they move forward with it. And so thank you both for this time, for the commitment to this work. And what you offer to so many of us in the field.
Thanks, John. Thank you, Tracey.
Thanks. So appreciate it.
Elevate and Relate is produced by the Alliance for Camp Health. The Alliance for Camp Health is a national 501c3 nonprofit and the leading authority on health and well-being for summer camps and out-of-school time programs. We prepare youth development leaders, healthcare providers, and behavioral health specialists to address youth well-being through research-backed, expert-led education, evidence-based practices, and educational partnerships, just like all the information you've gathered here today. You can join the Alliance for Camp Health as a member today and sign up for free for our Elevating Care weekly newsletter that comes out through the link in our show notes. Together, we're elevating care for healthier communities. I'm John Hamilton. Thanks for listening.